Thank you so much. Good morning, everyone. I'd like to say thank you so much for being here. This is our quarterly Hard of Hearing Task Force meeting. It's Friday, August 22nd, and it is 9:16 a.m., and we welcome everyone to the meeting. My name is Christy Abrams, and I'm the Hard of Hearing Specialist, and we're joining you from the Arizona Commission for the Deaf and the Hard of Hearing. A few important points to make that we'd like to share is our meetings are fully accessible. We have ASL interpreters, and we have communication access, real-time translation, which we know is CART, and it's captioning for hard of hearing people. That gives us access. And today in our meeting, CART is provided by a live human being who is highly trained, and that gives us the most accurate captions possible. And for those of you who may be joining via YouTube, a quick note on CART. This is something that hard of hearing people can request under the federal law, the Americans with Disabilities Act, for courtrooms, classrooms, workshops, medical appointments, entertainment venues, and beyond. So we'd like to put that message out there. Also, CART is the gold standard, and many people have yet to learn about it. So that's why we like to say a little bit more on what it is. And without further ado, I would like to introduce each of our Hard of Hearing Task Force members for roll call. And if you would please acknowledge that you're here with us here and maybe raise your hand. And then also, once you're done, go ahead and turn your camera off and please mute your microphone. Okay, and I'd like to say Ron Tallman. Thank you, Ron is here. Okay, Harvey Smith.
Good morning.
Thank you. Thank you, Harvey, so glad you're here. Liz Booth. Liz Booth is here, thank you. And we have Roz Siebold. Thank you for being here, Roz. And we have Barry Forrest.
Here, I'm here. Okay. I'm here.
Great, thank you so much for being here, Barry. And we'll go ahead and let you close your camera and then also mute your microphone. That's wonderful. Okay. And if anybody needs any help, let us know.
Oh. I don't.
If you go there, if you go down below to the video, you can close your camera if you hover over the video on the bottom left-hand corner. There we go. That's great. Thanks so much. Okay, so we've got our roll call all set. And what I would like to start out by doing, and that's we've done our little bit of housekeeping there. We want to make sure that everybody's all set and ready to go. And then we did our roll call. And for our next agenda item, we want to go ahead. Thank you for reviewing our minutes from our May meeting. And we'd like to have, anybody would like to make a motion? Is there either any revisions or changes needed for our minutes in May that you had a chance to review if you were with us in May? And if not, you're welcome to make a motion to approve the minutes as they are. Feel free to turn on your camera and let me know what comments you have. Harvey has made a motion to approve the minutes in chat. Thank you, Harvey. I appreciate that. And does anybody have a second motion to approve our minutes from May? Anybody like to second that motion? Harvey is making a motion to approve the minutes without any changes. Does anybody have a second that?
I'll second the motion.
Thank you so much, Barry. Barry has made a motion to second that. Appreciate that so much. And what I'd like to go ahead and do next is Michelle is on the next on the agenda, but I'm going to go ahead and let Rena go next because she doesn't have, she's not available for the entire meeting. So I'm just going to put Rena first. She's our community engagement coordinator. Rena, thank you so much for being here. And she's going to give our report. That's going to be the next item. I'm going to let you take it away, Rena. Thank you.
Okay, yes. Hi, everyone. This is Rena. I am the Community Engagement Coordinator here at ACDHH. I do want to share some updates. We have been hosting a virtual community consortium. It has been a wonderful opportunity for key leaders and organizers and advocates to gather together to discuss and recognize issues and challenges that are occurring in the community while identifying solutions for those challenges. Some of those topics that have come up in the meeting have been cross-organization collaboration, legislative advocacy, and awareness of community resources, policy changes within the community as well, and updating them. So we see that collaboration efforts and awareness for our community is a top priority. The VCC, as we call ourselves, is really, again, to bring together organizations and advocates to develop strategies and approaches. We have noticed that a few hard of hearing representatives are the consortium, but maybe this is new to you and you'd like to reach out to myself or Christy about joining. Our goal is to host the VCC regularly, whether that's every 3 to 6 months. It will depend on the needs that we're seeing and the topics that are occurring within our state. We are also developing Basecamp, which is a platform which allows us to have online access for those who are interested in participating. You can join through an invitation to see and identify who will be involved in these issues. If this is something you're interested in, please reach out and let me know. My second update is we recently released an assistive technology survey. The assistive technology speaks to any equipment or device that is used to help an individual communicate in their daily living. So that could be an improvement in their speech, hearing, or listening. We wanted more input from the community on what tools are currently being used and maybe identifying within the community what you see. That will help us streamline the process for our assistive technology program. We want to ensure that our consumers are aware of resources and tools within the community available to them. Your feedback for that survey is essential to help guide this process. So please take the time to fill out the survey. The survey will have an ASL interpreter for access, as well as CART and a voiceover. So access is ensured for all. The survey link I'm going to include in today's chat for easier access for all attending and viewing. Please take a look at the survey and fill it out at your convenience and spread the word to your network and anyone who uses assistive technology so they can also take a benefit of today's survey. Last, but definitely not least, we have already, let me back up, I apologized. Based on our partnership and our collaboration with the Arizona Burn Foundation, we have hosted 3 walks within our community And that has allowed us to put in over 400 alarms from the state of Arizona to really expand and support our community members so that the deaf, hard of hearing in their homes have accessible ways to identify a fire. Many of you may have heard of the tragic passing of a deaf individual, female, who passed away in a fire. We want to ensure that nothing like that happens again. So if you know of anyone who may benefit from a fire alarm, please make sure and contact us so that we can put you in touch with the Arizona Burn Foundation so that you have safe access in your homes. Lastly, for our last update, we look forward to seeing you at our next one when we're out and about in the community. Thank you, Christy.
Thank you so much, Rena. Does anybody have any questions from Rena? We're so fortunate to have her as our community engagement coordinator. Does anybody have any comments or questions for Rena? All right, Rena, thank you so much for that update. We appreciate you. And what we'll do next is thank you, Rena. We'll go next to our, now we'll hear from Michelle Michaels, our hearing healthcare program manager. And Michelle is going to do our ACDHH board report. Nikki's not able to be here today, so we're fortunate to have Michelle. And thank you. I'm going to let you go ahead and take over, Michelle.
Okay, thank you. Hi, yes, I'm Michelle Michaels. I manage the Hard of Hearing program, so program and services for the 1.3 million member Hard of Hearing community in Arizona. And I'm happy to be here this morning. Yes, Nikki Sukup, our interim executive director, has other conflicting appointments today, so she asked me to kind of recap her board report. So every time the Board of Commissioners has a meeting, then Nikki will provide a report to the board. And so I'm just going to review some of that on behalf of Nikki at this point. Of course, one of the most important things is we are fully funded for this current fiscal year. Our state budget was approved, and we were appropriated $5 million for this fiscal year, which started July 1. And one of the real thrilling things about this is that we were appropriated of that money, $350,000 we are able to use out of our fund to support the deafblind community members in Arizona. So that's an 82% increase over what we used last year. And so that expands our services for deafblind folks and for people who have severe combined vision and hearing loss. And so that's a really important program that we have that is managed by our Deputy Director, Carmen Smith. So really appreciate being able to use that funding for that community. We're also in the midst of a website migration and updated branding. So our website is going to go to a .gov website. It will be aligned with the scheme that you're seeing in more and more state agency websites. So if you go to Arizona Department of Transportation or something, DPS, you're going to see the same kind of scheme. And so our colors are changing just a little bit. They're still kind of an orange and purple, but a little bit different tint. So that's all coming in the next several months or so. And obviously it's a big process to migrate a website into a new platform. But we're rebranding all of our materials. We're going to incorporate more QR codes, make things cleaner, easier to look at. So just a better visual identity as well. Another thing is that we have a new contract for the Arizona Relay Service. And that's something as Michelle, Nikki is our TRS administrator, Telecommunications Relay Service Administrator. But I actually manage the Relay Service Outreach and Education. and monitor contract compliance along with our financial services unit. So we have a new contractor for the Arizona Relay Service, and that is T-Mobile. So T-Mobile did win the contract, and we went through the RFP process. And one of the things that we're looking forward to with Arizona Relay Service is hopefully next year, first quarter of calendar year 2026, being able to offer something called RTT, which stands for real-time text, which is a relay service product. So hopefully that will be able to roll out next January, February, March, and you will be hearing more about that and how do you use that? How does that benefit you? Nikki reports that our team of 20 people has been very busy with community work. Some of the things that Rena has mentioned with the smoke alarm and all that. There was an organization called DANE, D-A-N-E, Deaf Abuse Network, something like that. And they had a small little community event, which we sponsored, and Nikki received a Heart of the Community Award from DANE, so that was really nice. We also participated as a sponsor of the African American Conference on Disabilities and had a booth there as well. Christy was able to go to the HLA National Conference, so that was wonderful that we were able to send her there. Locally, we also had the World Elder Abuse Awareness Day Conference. That is something that we're always involved with. Elders, particularly elders who are deaf, deafblind, hard of hearing, can be subject to greater amounts of abuse. So that's something we keep our hands in to make sure that people are aware of that. We have the Deafblind Retreat of Arizona. We had staff at that event for our deafblind folks. And then RID, which is the Registry of Interpreters for the Deaf, we had, I think, 4 staff. We have 4 licensed interpreters on staff who went to that, got their CEUs, learned a lot of great stuff, a lot of good networking. And then we had 2 staff, Nikki and Kim, our deaf specialist, attended the Deaf Seniors of America Conference in Kansas City, my hometown. Go KC. And so again, the deaf seniors, we want to focus on our senior population as well. And then they also attended there's an organization called the National Association of State Directors of the Deaf and Hard of Hearing agencies. And so they had their annual conference and went to that. And then our family services specialist, Trina, is very involved with back to school events with the Arizona State School for the Deaf and Blind. So that's a little bit more of what's going on in that area, a lot of outreach and education. Something else that we're very involved with and is our interpreting department, and that's Victoria, Ashley, and Cameo, awesome people. They have been really involved with, and particularly Cameo, creating this Launchpad project for interpreters. And what that is all about informing high school students and college students about the opportunity to become an interpreter, to get more interpreters, ASL interpreters in Arizona, because we don't have enough for our deaf community, and developing interpreters. And so we have 26 participants. There are 13 mentors and 13 mentees. So people who can become interpreters. So that's really exciting. We had a change in our staff. So I said there are 20 staff members currently. We fully staffed would be 21. Our Director of Business Finance, Sue K. Kneifel, who some of you may know through vocation and rehabilitation. She's been involved with the state service for a long, long time. She retired on July 4th. We miss her. She is off doing other great things in her life. And then we're also working right now on creating our budget for FY27. So we are currently in FY26, which is July of 2025 through June of 2026. So we're currently in that budget, but working on FY27 as well. So that completes the board report on behalf of Nikki. And as always, if you have any questions for Nikki, you can reach her and I will drop her email in the chat. And sorry, Sandra, I know I'm talking fast, but Sandra is an awesome interpreter.
Thank you, Michelle. Does anybody have any questions on the report, the board report, before I move on to the Hard of Hearing Specialist report? Okay, all right, everyone. I'm going to go ahead and do my report. Just let me pull up the information that I want to share with you. All right, just one sec here. Get my notes so that I don't miss anything. All right. So I want to begin by sharing our Hard of Hearing Healthcare Assistance Project, HAP. That is a program that I work really hard on. I wanted to start off with that. It's in partnership with NAU, ASU, and U of A. And so that is a program that we provide that people can reach out to me to find out information for how to obtain hearing aids. And so I work really hard on that. And we want people not only to learn about the importance of having technology that they need, but also in that program, we provide oral rehabilitation. And so we want people to learn about communication strategies, self-advocating, other assistive technology, and the importance of connecting with other hard of hearing people. And to date, we have referred 126 people to one of those universities for the project. And so it's been really busy. And just in the past year, I've had more than 350 people reach out to me for information, resources, and help to help navigate as a hard of hearing person. And so it's just something that I'm really passionate about and really busy with. And one of my favorite parts of my position here at ACDHH is providing presentations with my colleagues. We do this both virtually and in person all across the state. And of course, our aim is to educate healthcare professionals, public safety, human service agencies, employers, entertainment venues, universities, you name it. We want to be there to help people have the information they need and what they need to understand about hard of hearing people. And so I also just really appreciate being part of that and working with my team and to provide that information. What Michelle mentioned, I did attend the HOA National Convention in Indianapolis, and it's always a surreal, really opportunity. It's the one time in the year when I feel as a hard of hearing person completely equal. I have full access during the whole event, and I was happy to see some of you there, and we had a wonderful time. And if you've never participated before, I hope you'll be able to attend. Next year it's going to be in Louisville, Kentucky, so it should be a wonderful time. Also, I wanted to let everyone know the Arizona Department of Economic Security, we call that DES, and the Division of Aging and Adult Services, which is the Department of Aging, invited us to present for them at the World Elder Abuse Awareness Day in June. So Kim and I, our deaf specialist and myself, provided a presentation for them. And WEED is a great conference because it's for individuals, professionals, organizations, and community members who want to learn more about supporting anybody over the age of 18 who has a disability. So we wanted them to have information on people that are deaf and hard of hearing. And we had a great time doing that. Another thing that I did recently that was really fun, I attended the second annual Phoenix Children's Hospital Family Event to support children diagnosed with hearing differences and their family. And Latrina, our family services specialist, came with me. We provided a booth. There was over 150 people there, families with children, and they really want people to learn about cochlear implant experience. They have a panel discussion of experts from the Phoenix Children's Hospital audiology, and the surgeon is there, so it's amazing information. And then they also have a panel of children of all ages, elementary up to teenagers who have been implanted, to share their stories and experiences. So it's a wonderful, wonderful event, and I think families really appreciate it. And it's maybe the first time they've come in contact with other children and families that are also hard of hearing. So it's great. Let's see, what else? ACBHH has been we received so many requests for presentations. And so one of the things that we did and that we've been focusing on during July and August is coming together as a team and really looking at our process and wanting to revamp our system so that we can provide just really a seamless experience and provide the best outreach and education possible for the entire state. And we're really busy, and we want to make sure that we do the best job that we can. So we're looking at that. We're looking at the slides and information that we present. We're coming together as a team, and it's really been a great experience. And we're always learning and growing and getting feedback from each other. So that's been really helpful. And Michelle might say more on that in her report. But also coming up, just a little bit of glimpse of what's coming up. We're going to be doing presentations with the Department of Children's Services. I'm looking forward to that. Vicki and I are going to be going down to Aloha, which is the Adult Loss of Hearing Association in Tucson, to talk with them and present with them. We're going to be heading out to Surprise to meet with it's called the Grand Drama Comedy Club, which is an entertainment venue out there in the Sun Cities area. So they have a lot of hard of hearing seniors and also a wonderful group of deaf culture people that also attend their events. So we want to make sure those events are accessible. So we're going to be meeting with them, and that'll be really fun. We're also scheduled for the second time. We've been invited back to the Chandler Gilbert Community College New Adventures in Learning class. They invited us back. And so that's another opportunity for us to share our information. And a lot of fun things coming up. So we're really hard at work. And that's pretty much it for me. I don't know if anybody has any questions, but that's what I focus on here as in my role. And does anybody have any questions for me on that part? We're switching interpreters too, so it's a perfect time for me to invite Michelle to join us back for the Hard of Hearing Program Manager report. I'll have her, Michelle will pop on and share a little bit more information. Oh, I'm so sorry. I see Harvey has his hand raised. Sure, Harvey. I'm sorry, just noticed that. Yeah. Hi.
Good morning, Christy. A question about the funding for the services provided by the universities. Is that safe? Is it federal funding, in which case we might have reason to be concerned?
That's a great question, and Michelle's gonna pop on for her report, and she manages the program, so I'm gonna let her share information on that. And I don't know if she has more questions back to you on that, but I'll refer to Michelle for that. She's gonna pop on here.
Okay, hi, I'm back. Okay, LaDonna, I'm gonna speak slower. I just get so excited. I love these meetings. I love all this getting together. So let me talk about what is going on in the Hard of Hearing program. Again, I'm the Hard of Hearing program manager. So I manage 5 different programs and projects. with my team, Vicki Thompson, who I know you all know. She is our wonderful assistive technology specialist, and Christy Abrams, of course, the infamous Christy Abrams, our hard of hearing specialist. So let me look at my notes here. I wanted to follow up first on some things that Rena talked about. So Rena works in our public policy and community engagement unit area. She is our community engagement person. So if you have an event like, Ron, I'm looking at you, Walk for Hearing, any kind of event like this, maybe it's a celebration at the Adult Loss of Hearing Association, anything like that, any kind of event. We also have something called sponsorships, and it's not very well known yet, but this is something that Rena is managing. So Rena is going to be managing community events. For instance, earlier this year, I think it was March, we had a wonderful event at the Heard Museum. And so Rena is managing our smoke alarm walks and all of this kind of stuff. So there's something called sponsorships, and there's a link on our website, which I'll drop into chat when I'm done here. But you could just go to our website and find the sponsorship link. So if you're looking for ACDHH to sponsor an event, please complete that form so that Rena can work on that and hopefully get that approved. So I want to make sure you know about that. The other thing that Rena, again, is coordinating is what we call the Community Consortium. So this is a gathering of leaders in all the communities we serve. So the deaf community, deaf, blind, people with combined vision and hearing loss, and the hard of hearing community. And what I found with the deaf community is a small community. There are about 25,000 deaf people in Arizona, but they have a lot of organizations. And so they have a lot of organizations that are represented on this community consortium. Whereas the hard of hearing community, being huge, 1.3 million, really don't have many organizations. Because why? We're everywhere, right? 1 out of 5 or 6 Arizonans is hard of hearing. So we are everywhere. And we don't have as many just focused on the hard of hearing. We have HLAA, we have Aloha, we have Audible Talkers Toastmasters, and that's about it. We don't have an AG Bell chapter here. We do not have an ALDA chapter here. And so what I'm seeing with the Community Consortium is there are a lot of representatives from the deaf community, the deaf blind community, and thank you, Ron, for popping on and being part of that. So what I'd like to see is more representation from the leaders in the hard of hearing community, whether you're running a group or an organization or whatever or not. And I know there are other leaders out there who may be watching this or maybe watch it later, to get involved with our community consortium so that we have representation. Because Christy and I, we're staff, so there's only so much that we can do, whereas you as community members can step up and be involved in initiatives that our agency is working on. So I just want to encourage others to get involved with the community consortium, to represent the voice and the needs and the perspective of the hard of hearing community. So there you go, there's my pitch. Okay. We do have the AT survey. Again, this is something that Rena and Vicki on my team, Vicki, our assistive technology specialist, worked on a little bit earlier this summer. And then Rena and I continued to work on it together and finalized it. And Rena got all of the captioning done because every question is in not just English or Spanish, but also in ASL. So every question is English or Spanish, ASL videos also have captions and voicing. She coordinated all of that, did a fabulous job. It's a short-ish survey, about 20 questions, I think, but really, really important for the vision, my vision of where this agency goes as far as assistive technology. So you may know that we have our what we call our free telephone program, AZTEDP, where for decades now we have provided free telephones, no cost, TTYs, amplified phones, alerting devices, these types of devices for telecommunications. I want this to change into an assistive technology program. And so what we need is to know what you need. So last July, for this past fiscal year, I implemented a new tracking database for us where Vicki was able to track every request she got for assistive technology. And there were about 75 requests, I think. And so that's people saying, I need to know how to get a baby cry signaler or a smoke alarm or a fall alert watch or anything like that. Any type of assistive technology that will help any of our communities, deaf, blind, CVHL, speech impaired, the communities we serve. So please complete the survey, share the survey. I know Rena's working on a flyer about that. It's going to be open for 2 more months. So as you complete that survey, we'll be analyzing the results and looking to create the data, to have the data to create the assistive technology program for ACDHH. So I'm really excited about that. Okay, to Harvey's question. The Hearing Healthcare Assistance Project is specifically not called a hearing aid project because, as we all who are hard of hearing know, a hearing aid or a cochlear implant helps, but it is only one small part of the puzzle to how we get through life as hard of hearing people. So the Hearing Healthcare Assistance Project is a project that I developed under the direction of Carmen Smith, our deputy director, and took a number of years in working on that, creating this project. We use funding from our own state budget. So Harvey, it's not federal funds, so no worries there. We have a small amount of money allocated to our project. Fortunately, we do not have to buy hearing aids under our budget because the universities that we partner with are really great at getting donations of new or gently used, but really good used hearing aids that they can refurbish. So the hearing aid, which is the biggest cost, is not something that we have to bear. But we cover the complete hearing exam. So this is a diagnostic audiology exam. This is not just a, pass, fail, beeps, or anything like that. This is a complete diagnostic exam. And then if the person qualifies audiologically, then the hearing aid fitting, whether it's 1 or 2 hearing aids, the ear molds, all the parts of, the batteries, wax guards, all of that is covered, as well as the oral, AURAL, oral rehabilitation, which is the most, I think, significant part of the project. Because, again, we know somebody can get a new hearing aid, they put it in their ear, and they're like, doesn't really fit well, or it's too loud, and it goes in a drawer. That is not what we want to have happen. So all the follow-up visits are covered. We encourage people to go back to see the audiologist at one of the universities, and then to participate in the oral rehabilitation classes, which are the one-on-one training on how you use the device, how you would use a remote mic, what types of hearing assistive technology are out there, how to communicate with your spouse who you've been with for 30, 40 years and your communication patterns are established. How do you communicate in a new way? How do you ask for accommodations? All of that is part of our oral rehabilitation project, part of the HAP. So again, Harvey, don't have to worry about the funding. I'm pretty persuasive in getting the funding that I need for this project as well. And I hope that it will continue for many, many years, because there are just so many adults who are low income, who have no resources. They are not veterans. They are not working adults. They're not enrolled members of a tribe, who have nowhere to go for hearing aids. And they come to us, and they come to Christie. Again, over 350 people in our last fiscal year reached out to Christie asking for hearing aids. So really important project. Okay, let's see. Another thing Christie mentioned, we do get asked to deliver trainings, presentations, speaking engagements, you name it. And we love it. We love being popular. We want to be more popular. But we get so busy that we just needed to say, hold on, let's just stop here and kind of back up, and let's look at what we're doing and what is the impact. And so Carmen Smith, our deputy director, rallied her team, because all of us who work in direct client service, we report to our deputy director. And she got us all together and said, let's just revamp. Let's just start from the very beginning. From the time a person calls us and asks, hey, will you come down to our place and talk to our folks, to how does that get to the managers, how we decide who is going to staff that, the creation of the PowerPoint, the slides, the design, the content of it, all of that. And so we've got another meeting this coming week. Will be our 7th in-office meeting, where the team is getting together and just going through everything, because we want to deliver a quality product that meets the needs of the people who are asking us to come and train them or present to them. And so really excited about where this is going. As we get back out there in a few weeks, I think is our next presentation, you're going to see improved delivery. We've all got our talking points now. We've practiced our elevator speeches. So just really raising the level of quality of our services. Okay, let's see, what else? A couple of things that Nikki already mentioned. I did want to say, so in the last fiscal year, my team, Christy, myself, and Vicki, delivered 35 trainings, presentations in 1 year. So that's almost one a week. When you take out the holidays and things like that, right? And then we also, my teams participated in 14 different booths. One of the things that Vicki did was the city of Phoenix asked for a training on how to use the relay service. What happens when you call 711? What happens? Or if somebody calls you and you hear, this is the Arizona relay service, how do I handle that phone call? So they wanted training for the city staff. Well, there are 14,000 staff for the city of Phoenix. That's a lot of people. So I tasked Vicki with creating a video training that the city of Phoenix uses. And so they put it on their intranet, secure intranet for their employees. And in, I think it was April, May, June, so 2.5 months, almost 300 city staff of the city of Phoenix logged in, watched a little training. It's just 23 minutes, very easy to understand. And so now they are better positioned to accept a relay call. In that video, Vicki also talks about video relay service. So if they answer the phone and they hear, this is Sorensen video relay, they're not like hanging up, right? If you hear relay, we don't hang up. But they know how, okay, this is a deaf person using an ASL interpreter. Okay. So they know better how to handle the phone calls from millions of people who live in the city of Phoenix. So really glad to see that. Love that partnership with the city. Let's see, what else? And along with another thing that Vicki is working on in AZTDP. Oh, it's 10 o'clock. Let's change. I'm going to hold till we can change interpreters.
You going ahead, Michelle?
Okay, all right. I don't want to, I'm almost done. We have the applications for AZTDP for our phone program and our alerting products. And there are a couple really wonderful personal listening devices that work with smartphones. Vicki is converting those into Spanish. We want to reach our Spanish-speaking communities. So those are almost done. So you'll see those come out pretty soon. I think last but not least, we have a 5-year strategic plan, our agency does, with 5 different outcomes. And so every year we look at those outcomes and we refine our objective for the next fiscal year. And we determine what our metrics will be, what our initiative, how are we going to reach those accomplishments. And so that is on our website, and I will drop that in the chat as well. So take a look at our strategic plan. Again, we have the Hard of Hearing Task Force meeting because we want to share information with the community at large. But we also want to hear from you, the leaders in the hard of hearing community. So please let us know what we can do to help you and the communities that you're involved with. And I think that is at which point I will wrap this up and we will change interpreters. So any questions? I know Christy will pop back on and manage that. Thank you.
Thank you so much, Michelle. All right, next on our agenda, we did have Aloha, and Cynthia isn't able to be here with us today. So I'll go ahead to the next agenda item, which is our Hearing Loss Association of America, or HLAA, chapter leadership announcements. And Fred, if it's good to start with you with HLA West Valley, if you want to share a few comments, and we'd love to hear how everything's going.
Thank you. Thank you, Christy. Just a couple of comments here. Our West Valley chapter, since the last task force meeting, our primary task was to make sure we had a place to meet in the coming season, because we wanted to move out of the very large hall we were in and reduce cost. And we think we figured that out. So that was our number one priority. The second is to line up our speakers. We're working on that. And we have half of them so far, and we'll have those wrapped up pretty soon. We're working with Ron on the Walk for Hearing and try to help with that and bring in some money. Things are changing all around us, but we're going to give that a good shot and work with Ron on that. And he'll probably have more. We're constantly looking for a better way to market ourselves and to bring in more people. So generally, that's what we're doing in the West Valley in the midst of a lot of change all around us. And we appreciate all the help we get from the Arizona Commission and from Ron and HLA and a number of other people that we work with. And that's pretty much our update at the moment.
Thank you, Fred. I look forward to coming out and talking with the HLA West Valley in October. So looking forward to being with you all then.
Yes, we are too.
Yeah.
Thank you.
Thank you, Fred. Okay, and next we'll have Ron pop on, and we'll look forward to hearing about the HLA East Valley. Thanks, Ron.
Hi, everyone. It's been a nice summer break. It's been hot this summer, though. Coming back, we will start up chapter meetings in October. Our first meeting will be the 9th. And we do kind of a hope hearing other people's experiences and what did everybody do on their summer vacation. Also, Christy Abrams is going to join us in October, and she and I are both going to talk a little bit about our experience at the 2025 HLAA National Convention. In November, we're going to bring Michael Buckley back from AZ-TAP. That's an Arizona Technology Access Program where you can borrow specific types of technology that something might help, telephones and things like that. So we're looking forward to that. It's been a long time since we've seen them. December we're trying to bring in the Sun Lakes Fire Department and the Sun Lakes Police Posse to talk about emergency situations. We have the fire department firmed up, but having difficulty contacting someone at the police department. I think if I went out there and committed a few crimes, it'd be about the only way I'll be able to get to talk to someone. On January 8th, Shannon Tyree from the West Valley, I'm sorry, is going to come out and talk about cell phone apps. And just to let everybody know, Shannon received a award this year from HLAA National at the convention for her work on explaining how to use specific apps on your phone that will help for those of us with hearing loss. So she has agreed to come out and talk to our chapter for that. In February, we're going to welcome back Eldon Bordenoff, who's going to talk about fall preventions, which is always a good subject. Then a new speaker for us will join us in March. Her name is Ina Brown, and she's going to talk about tips and tricks for hearing loss. She was also at the convention. On April 9th, we're going to welcome Elena Massaro, and she is going to talk about the differences between cochlear implants and hearing aids and understanding audiograms. Then last but not least is my favorite speaker, Michelle Michaels, is going to talk about 35 years of on the American Disabilities Act. So I'm really looking forward to that. So it's been a great break, but I'm ready to go back and start seeing some friends again. So on the Walk for Hearing side, things are moving a little bit slow. We have a goal of $50,000, and we have currently raised $8,000 or $7,800. But we're moving in the right direction. We have 7 teams built and 21 registered walkers. So my advice to anyone who would like to come out and participate is please go ahead and start building your teams now. And if you know anybody who is a nonprofit or a state organization, have them contact me. We might be able to work them into an alliance program or a table program that could bring them out to the walk. The walk this year will be at the same spot, same place. The course is going to change just a little bit, and we're looking forward to having at least 400 people out there. So let's get the word out and invite your friends, your family, and let's have a good 10th annual Walk for Hearing. Thank you.
Thank you, Ron. The commission will definitely be there again this year. We always appreciate being part of the Walk for Hearing, and we've been talking internally about that, and we'll be building our team and participating again. It's always such a great event. All right. And so we have, we do have last on our agenda, we have any additional announcements. And I also want to invite Harvey. We always love to hear your input and hear how things are going on your end. So whatever you might have to share with us, Harvey. Thank you.
So thank you. So we're seeing an uptick in the number of job seekers. So I had a career fair in Mesa about 3 months ago, and we had about 130 job seekers. I had a career fair in Mesa last week, same location, and had 240 job seekers. So we are seeing a substantial increase in the number of people using our services. We are seeing that jobs are being posted for a shorter amount of time. So if you're looking for a new job and you see one you like, don't wait, apply to it today. And part of the reason for that is a lot of people are using AI, ChatGPT, to tailor their applications and their resumes to get past the applicant tracking system when they apply for their jobs. So, as an example, I was talking to a recruiter who posted a job, and it was posted about 4 o'clock in the afternoon. When they came back into the office the next morning, they had 150 qualified applicants that met the minimum requirements. So at that point, they shut down the job posting because there was no way they were going to get through all 150 applications in a reasonable amount of time. So the recruiters are really getting snowed under. And what this means is they're getting increasingly picky about who they interview and why. We are seeing increases in pay for certain jobs, especially in finance and healthcare. The flip side of that is we're seeing increases in mass layoffs, we call them warning notifications, and we're seeing them across industry, not just any one particular kind of business. And so that's a bit of a worry. We are seeing people looking for new jobs because of cost of living. They like their job, but they're just not making enough money. We're seeing people moving jobs to reduce their commute. So they like their job, they're good at it, but they don't want to spend 2.5 hours a day in the car. Okay, so we're seeing that too. One trend we're seeing that is very disturbing is recruiters that specialized in DEI. A lot of them are being reassigned or simply let go. We're seeing this in particular with the Fortune 500 companies, where they are essentially de-emphasizing hiring persons with disabilities, and that's going to start causing some trouble soon for a lot of people. So it's a very mixed picture. There's still wonderful jobs to find. There's still lovely employers who are looking for quality people. There are still opportunities to change careers or try something new. But there is that undercurrent of other issues which we do need to pay attention to. So our next career fair, next one I'm running, is going to be October 2nd at the Eagle Community Center in Mesa. So if you'd like to come and see us, we'd be very happy to have you. Thank you.
Thank you so much, Harvey. There's so many interesting things that you touched on, and one of them that I hadn't considered is the impact of AI and ChatGPT as far as people and how that would impact employment and people searching for employment. So I hadn't thought about that. And for your fair coming up in October, please feel free to share the information with me, and I can pass it on to our social media and post that for you too. So I'd love to do that.
I will. Thank you.
Okay, thank you. All right, and we're switching interpreters here. So a lot of great information, and I wanted to now ask for those of you on the call that haven't had a chance to share any additional announcements or questions or comments. We always love to hear from everybody, so feel free to pop on your camera, and if anybody has anything to share. Let's see, Michelle put something in the chat. Oh, yes. Thanks for adding that to the chat. Let's see. Oh. Thanks. Michelle added the ACDHH has a job board where employers and recruiters can post jobs, and she shared the link there in our chat. And Harvey also shared his contact information for anyone that you may come in contact with that has questions regarding employment. So that is really helpful. Does anybody else have any other suggestions or comments or things that you would hope to have maybe in an upcoming meeting, and I'll keep everyone posted on our next meeting and the date. Does anybody have any suggestions or any additional announcements? All quiet. All right, well, we appreciate having this opportunity to share our information with you, and we always want to be connected with everything happening in the communities so that we can all best support our hard of hearing people in Arizona. Like Michelle said, there's more than 1.3 million, 1 in 5 of us are hard of hearing. So, and a lot of times, I always say in our presentations, many hard of hearing people don't know anyone else but themselves that's hard of hearing. So for me, I really believe when they can connect to other hard of hearing people, it's the most helpful thing. And let's see, Harvey also shared a file in the chat. Thank you, Harvey, for doing that. So that is also in the chat, a job last flyer. Okay, thank you, Harvey. I'm gonna click on that so I can save it. Okay, thank you for sharing that. Appreciate it, and I'll do a social media, we can post that. All right, well, if everybody wants to turn on their cameras, you feel free to just say, we'll say, we look forward to seeing you at the next meeting, and I'll keep everyone posted. And we appreciate all that you do to support our communities. And thank you much. Thank you, Carmen, for being here too.